My name is Hilary Todd. I work for two organisations. I work for Solent NHS Trust, which is a community and mental health provider, where I'm the Associate Director of Occupational Health and Wellbeing. And I also work for the Hampshire and the Isle of Wight Integrated Care System as the Programme Director for our Occupational Health and Wellbeing programme. So I'm in possibly a unique position in that I see both sides of the support that's needed for our people, which is from an organisational perspective and also from a systems perspective. Hampshire and the Isle of Wight ICS bid for a number of projects within the programme, and we were fortunate enough to win bids for both enhanced occupational health and wellbeing, primary care occupational health and wellbeing, inclusivity and growing OH. And this has meant we as a system are able to take a holistic approach to the health and wellbeing of our people across primary care, optometrists, dentists, pharmacists, as well as people in acute and secondary care. So what we've been able to do is look at all aspects of health and wellbeing and understand where the gaps are, and then prioritise work in a number of areas. So for instance, we are supporting the winter workforce preparedness work that all our organisations are doing with a winter wellness campaign that is aimed at all staff and will be available to all people across the system. We are recognising the need to support our people in the sort of rest and recover phase, and actually getting people well in work and well at work. One of the aims of our programme is to provide equity and equality for all people in the system, and therefore with our inclusivity programme we're able to do that through primary care, acute and secondary care, but also identify what a future occupational health and wellbeing model needs to look like. We're very lucky in the system in that our providers and colleagues across the organisations are working incredibly well together. We have a very collaborative approach, and the sharing of good practice and people's expertise from different sectors and from different organisations is amazing. And I think there is a recognition that we do all need to work together to improve the health and wellbeing of our people. One of the challenges we have faced already is the early onset of winter pressures, and we've recognised that within our programme, and are bringing plans forward to support people in the here and now. Our winter wellness campaign will include support for both people and for managers to support people to keep well in this particular moment in time when the pressure is increasing on our staff. There will be action plans for people to look at and to consider how they can keep themselves well, both physically and mentally, as well as on our self-help portal, which is a repository of self-help information that covers everything from fitness videos, cookery, how to keep well through the winter, healthy living, self-help, healthy working environments. And that is available to all NHS people via either an Android phone or on their own device at home. So we're putting an awful lot of information on there as well about how people can keep well through the winter. And it is a challenge for people because they often don't have time to look for information and guidance and support while they're at work, and need something quick and easy they can get to out of work, so it's there when they need it. We are going to build on that, getting more and more information on the portal for both primary care, for optometrists, dentists, pharmacies, and also where other offers are available to support people. But it is a challenge, and we do recognise that we have to have a multifactorial approach so that so staff and people can access things in their own time and at their own pace. What we have to look at is sustainability. So actually what can be sustained by either organisations or by the system. And of course that requires funding. But I think the Growing OH project is looking at the long-term provision of occupational health and well-being, because ultimately that's our workforce, and those are the people that we need in work to care for the populations we serve. So that, I think, is looking at how we can do things maybe differently to support the whole of the NHS workforce. And that's always going to be a challenge, because that goes alongside money and funding for patient services at the same time. But I think what there is now is there is a recognition that the NHS workforce at the moment are exhausted and do need that additional support to keep well, particularly over the winter, into next spring. Everything from the COVID boosters and flu vaccinations to offers for staff wellness that they can access at home. One of the biggest areas that we are seeing an increase in is reporting of stress, anxiety and depression. And those are again areas that we will be focusing on to support staff. I think one of the things that I would also like to keep going is this sense of collaboration between organisations, recognising again that the occupational health staff, occupational health clinicians, occupational health physicians and health and wellbeing teams are vital in supporting our people. And therefore, if we can do things well between us, that's going to be much more efficient than trying to stretch teams that are already stretched into doing things perhaps not as well as we would like.